What's up, guys? All right, let's talk about heroin to Suboxone to nothing. Specifically, I had a question. Is it more difficult when transitioning from heroin to medication assistance if your plan is to then be off of all medication assistance? Is that a more difficult process if you're coming from heroin versus if you're coming from pills? And, to complicate a simple answer, it depends. I found that it's very, just patient dependent on a lot of circumstances in someone's addiction history, their social history, the childhood trauma, the stressors that they have been going through, their psychological makeup. All these things play a role in how successful you're going to be with tapering off Suboxone. So I know that didn't really answer your question, because you specifically, someone who asked the question, they had already transitioned to Suboxone and were actually already tapering. Sounds to me like you're doing great, okay? I would remind you, don't listen to me on the internet. Go talk to your doctor about any questions you have. But it sounds like you are making great progress. And the main thing is you're off heroin. That is the main thing. And always keep the main thing the main thing. A lot of times we start to major in the minors, right? We start to get caught up in the little details of trying to perfect every little aspect of our life. But always keep the big picture in mind, okay? And even if you get frustrated because you're having a difficult time going, from 6 milligrams of buprenorphine to 4 milligrams of buprenorphine, in the grand scheme of things, you're not overdosing. You know what I mean? You don't have a needle in your arm. You're not stealing money from your grandma, okay? So keep the big picture, and that's going to help you stay motivated. It's going to help you stay positive, help you, keep the right mindset for moving forward. Now, I will take this time to remind you that not everybody needs to be in a taper process. Some people need to be stable longer. And I will remind you that not everybody needs to stay on buprenorphine forever. A lot of folks need to start the process of tapering and trying to get, off of the medication assistance if able. And so that's why it's so, different for different people. And you can't listen to somebody who says one way is the only way with addiction recovery, because that's just a bunch of crap. It's not true. Different strokes for different folks. So what other questions do you have about this process that I can answer in like a quick video like this? I'd love to hear it, and I will, try to be diligent to answer as many questions as I can. I will say this is not medical advice for you, because I don't know you, and I want to make that clear that you always need to be making these medical decisions with your doctor, okay? All right, guys, that's it for today. I had a good week. I had some new patients that I've been helping. One guy, very young, that, I think he's early enough in his addiction that we can prevent a lot of long-term complications. And obviously, the first thing we're going to prevent is him overdosing. That's the hope, if he will, stay on the plan. Now, and God willing, everything goes as planned. But that is the hope, that we can prevent him from overdosing, get him clean, get him sober, and then start making these more, start working on the actual recovery process. But I don't know why, but this guy struck me that I think we'll be able to get him on medication assistance and then taper him off possibly fairly quickly. And then kind of work on some of the other issues during this time that kind of led him to drug use in the first place, which was a lot of, some mental issues, some depression, and just some other psychological, barriers and things that we're going to work on. And I think he is going to have success. All right, guys, have a good weekend. Peace.